on the web, and in your hands. This is MDiTV.
Obesity is bad for your heart, except when it isn't. Allow me to explain, and then I'll fill you in on a new twist to the story. While extra pounds increase the risk of developing heart disease, researchers have noticed that when they track people who already have heart disease, heavier patients tend to fare better than their lighter counterparts. It's not clear if extra weight actually offers some direct protective effect or if there's something else going on. But researchers have begun to expect that when they test heart disease treatments, they'll see better results on average among the heavier patients. So here's the new twist. Researchers compared two types of drug-eluting stents. Those are wire mesh scaffolds threaded into clogged heart arteries to hold them open. The two stents had different drugs embedded in them that are intended to reduce the rate of new blockages. One type of stent delivered a drug called biolimus, while the other type had sirolimus. Now, this trial was meant to see if there was any difference between the two types of stents. But the result that caught the attention of the researchers was, to their surprise, among these 1,700 participants, heavier patients fared worse than thinner ones. Combining the rates of heart-related death, heart attack, and repeat procedures to reopen an artery blockage, the researchers reported in the American Journal of Cardiology that almost 9% of normal weight patients had a bad outcome within 1 year. The rate among overweight patients was just over 11%, and obese patients had the highest rate of problems or death, 14.5%. Investigator Giovanna Sarno says the analysis puts the obesity paradox in a new light.
In contrast with some previous studies that have reported the so-called obesity paradox, these findings suggest that it's the obesity itself that could trigger physiopathologic mechanisms leading to more adverse events.
While this trial can't explain why heavier patients fared worse this time, Dr. Sarno and colleagues have some guesses. Maybe obese patients have some metabolic mechanism that's accelerating the breakdown of drugs that reduce the risk of blood clots. Or perhaps they have more problems with inflammation in their blood vessels. Whatever may be going on, interventional cardiologist Dr. Todd Caulfield says he's not going to change how he uses drug-eluting stents with any of his patients based on the results of just one study.
This is something that raises a question but should not raise an alarm. Something that we'll look into further, but that's something that you really should not be changing practice at this time.
Since this trial was designed to show differences between the drugs in the stents and just happened to reveal an association between weight and outcomes, it might be that something else is going on that they didn't measure and that would explain these unexpected results. In the meantime, because some of the bad outcomes appear to be related to a higher rate of blood clots forming inside the stents, the researchers suggest that for their heavier patients, doctors might try boosting the doses of drugs meant to prevent blood clots. Oh, and one last thing. As for the primary outcome, the researchers were testing whether there was any difference in how the patients did depending on whether the stents used biolimus or sirolimus. They saw no difference.